Today, what is sarcoidosis? What are its symptoms? How is sarcoidosis diagnosed? Please don't forget to watch the video to the end, and don't forget to subscribe to our channel, which many people are interested in. Sarcoidosis. Sarcoidosis is a disease of the immune system. The immune system overreacts and forms nodules called granulomas. Symptoms vary depending on the location and size of the granulomas. Likewise, the severity of symptoms depends on the granulomas. In some cases, sarcoidosis may not show any symptoms at all. In some cases, granulomas can develop into fibrosis, causing permanent damage to the lung. What is sarcoidosis? Sarcoidosis is a type of systematic disease in which nodules called granulomas appear. Sarcoidosis is extremely rare. It usually affects the lungs and lymph nodes. Sometimes symptoms of sarcoidosis can also be seen on the skin. Symptoms of sarcoidosis vary depending on where and to what extent the disease affects. The severity of the symptoms also depends on the granulomas formed in sarcoidosis. If granulomas have formed on the skin, tender bumps may appear on the skin. Granulomas in the lung can cause shortness of breath and persistent coughing. In cases where granulomas develop into fibrosis in the lung, the patient may have permanent lung damage. If the symptoms of a person with sarcoidosis are not severe, they may recover without treatment within a few months or a year. In some cases, however, symptoms may tend to worsen gradually. This condition is called chronic sarcoidosis. There is no known cure for sarcoidosis, but symptoms can be controlled with medication. This improves the patient's quality of life. What are the symptoms of sarcoidosis? Symptoms of sarcoidosis vary depending on which organs the disease affects. Initially, sarcoidosis usually presents with symptoms of persistent dry cough, fatigue, and shortness of breath. But it is also possible to see other symptoms in addition. These symptoms include tender and reddish bumps or spots on the skin, redness and tearing of the eyes or blurred vision, pain and swelling in the joints, enlarged lymph nodes in the neck, armpit, and groin, enlarged lymph nodes around the chest and lungs, hoarse voice, pain in the hands, feet, and other bony areas due to cyst formation in the bones, kidney stone, enlargement of the liver, heart rhythm disturbances, inflammation of the lining of the heart or heart failure, and nervous system problems such as hearing loss, meningitis, seizures, or psychiatric disorders. Symptoms of sarcoidosis vary from case to case. In some cases, symptoms may start suddenly and severely and subside in a short time. In some cases, sarcoidosis can manifest itself slowly and with long-lasting symptoms. In some cases, there may be no symptoms at all. Therefore, correct diagnosis is very important in sarcoidosis. What causes sarcoidosis? Sarcoidosis is a disease of the immune system. It occurs when the immune system goes into overdrive and attacks the body. Over time, inflammation caused by an overreaction of the immune system leads to the development of granulomas in the organs. Diseases in which the body attacks itself in this way are called autoimmune diseases. The most well-known autoimmune diseases are rheumatoid arthritis and lupus and sarcoidosis. It is not known exactly what causes the immune system to damage the body. However, some people are genetically predisposed to autoimmune diseases, and environmental factors are thought to cause these diseases. Sarcoidosis is not contagious, so it is not passed from one person to another. How is sarcoidosis diagnosed? As with many other diseases, sarcoidosis is diagnosed by first taking the patient's history, physical examination, and then some tests. Imaging methods such as chest X-rays and biopsy tests for suspicious granulomas are often used to diagnose sarcoidosis. Sarcoidosis can be confused with other diseases as it can affect many different systems and present with different symptoms. It is very important for the physician to differentiate sarcoidosis from other diseases to confirm the diagnosis. The specialist may need different tests for this. These tests are listed as follows. Computed tomography. Computerized tomography, used to find out if the lung tissue and lymph nodes in the chest are normal. It also allows the visualization of granulomas that develop as a result of sarcoidosis. Pulmonary function tests. Pulmonary function tests, non-invasive tests that measure how well the lungs are working. Laboratory tests. Laboratory tests, blood or urine tests, are used to see how well organs, especially the liver and kidneys, are working. The chemicals measured in these tests provide information about the condition of the organs. Electrocardiogram. Electrocardiogram, a routine office test that shows the electrical activity of the heart. Electrodes are attached to the patient's chest and measured. Nuclear imaging methods. Small amounts of radioactive material are used for positron emission tomography and gallium scans. These scans can show inflammation in the body. PPD test. PPD test used in the diagnosis of tuberculosis, TB. It is used to exclude TB, which can be confused with sarcoidosis. Eye examination. Eye examination. This is done to look for eye symptoms of sarcoidosis. As a result of the imaging, the specialist may find it appropriate to perform a biopsy. For this, the patient may need to go to the thoracic surgery department. The result of the biopsy helps to understand the cause of abnormalities that appear on imaging. Treatment for sarcoidosis can vary depending on where the disease affects. If you suspect you have sarcoidosis or have questions about the treatment of sarcoidosis, you may want to consider consulting a specialist. Finally, regular doctor checkups and preventive health care can help us detect and treat potential health problems early. Therefore, it is important to keep regular health checkups and monitor our health. Remember, health comes first. We wish you a healthy day. Please don't forget to subscribe. If you like this video and share it with your family and friends, they will learn it too.